Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about some of my favorite leg exercises that I like to do in a seated position for patients. But before I begin, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So a lot of patients that I see, especially if they're struggling with some deconditioning or some weaknesses in their leg muscles, they might not necessarily be able to do weight bearing or more day-to-day kind of functional exercises due to these weaknesses. And so in a lot of cases, right, I'll have patients start out with certain exercises in sitting initially in order to isolate these muscles that are a little bit weak, and then to eventually work towards more weight-bearing and functionally specific exercises as they're able to tolerate more weight due to an increase in strength. So as a result of this, right, a lot of cases will have to start out in this sort of non-weight-bearing sitting position in order to start building up the strength in these different muscles. So I want to go through some of my favorite ones to give in a seated position. So the first one I want to talk about is just a simple knee extension exercise to help work on strengthening the quadricep muscle, which is the muscle out in front here. And so with patients in this seated position, all I'll have them do is simply try to extend out the leg, right, and then back down. Now, in a lot of cases, what I'll make sure is that they're in a good sort of posture, right? So up nice and tall. I might even have the patient use a little lumbar roll or rolled up towel in the lower back to keep good posture and to not put any stress in through any of the nerves that run down the back of the leg, like the sciatic nerve, for example. So we want to have good posture here, right? You can do a little bit of a shoulder squeeze, and then again, I'm just having the patient simply extend out that leg and then back down, right? And so depending on which leg's involved, right, we might alternate between the two sides. And again, it's to build up that strength in the quadricep muscle. The opposite muscle to the quadricep muscle is called the hamstring. That runs on the back of the leg. And so again, what I'll have patients do in this case is an isometric hamstring contraction, where they're simply placing their heel against the floor and then just gently pushing down, right? So as I'm holding here, I'm feeling the muscle in the back of the leg. I'm gonna hold that for a second or so. And again, I can do that on either side. So now again, I'm working on building up some hamstring strength. Another great one to do in sitting is simply just some glute squeezes. So essentially with this, I'm squeezing my buttock muscle, gonna hold for a second or so, and then relax. I'm squeezing my glute muscle, holding for a second or so, and then relax. And then finally, in terms of, again, a glute strengthening exercise, this is more specifically for the glute med muscle, which runs on the side of the hip here, and it's really responsible for dynamic pelvic stability. So it's really important in terms of when we're transitioning from these non-weight bearing type exercises to more weight bearing, it's going to be a really important muscle in terms of walking, standing, pelvic stability. So with this exercise, what I'll have patients do is simply place their hands on the side of their legs, and they're just doing a little push against the hands here. So again, with this, what we're trying to activate here is called hip abduction, right? Where we're basically going into an external type position with the legs. So bringing the legs outwards in order to activate those muscles. So again, it just gives you a couple ideas to work on in terms of in a seated position where there might be some deconditioning, and the patient really needs to work on building up this strength non-weight bearing prior to progressing to more functional specific exercises. If you have any specific questions or concerns, feel free to leave a comment below, and please check with a physiotherapist to make sure that these exercises are appropriate for you. Thanks again for watching, and have a great day. Take care.